Great. Okay. So, well, firstly, this is so exciting. Even though we're in this insane space together, the fact that we are taking a journey together to try and make camp space safe and accessible for everyone. We're excited that we're doing it, and we're grateful that you all are taking this journey with us. The point of today is to really show you where we are with our research, with how we expect camp to go. As you all know on your own, things are changing daily. So we are obviously looking and adapting those changes as they come along. So what we have now may be slightly different, of course, you know, in 4 or 5 months or even 6 months, I don't even know timing right now of when, you know, July, is that 5 months away? So things are happening so quickly, but we know that, you know, we're just gonna do our best to continue to update the guidelines that we already have. And we're also grateful that we have an incredible medical team that we are able to communicate with, who have worked with us so they know the specifics of our camp, which we feel really grateful for. So for new families, I've met most of you, but my name is Cassie and I've been with Beam for a really long time. I won't say how long, but it's really the light of my life to be able to have had all the amazing experiences and provide those experiences for other young people. And I'm here with the other 2 full-time Beam Center staff members who will also join us at camp in the summer. Mitchell Dose, who is, I will not do him a disservice by just naming a few things that he does, but he does so many things, as Rebecca Zykam, who is similarly highly skilled, and we will be grateful to have them join us at camp this summer. They have been leading the research that we're going to go through tonight. So we are all grateful to them for that. So how we're going to start, we have a presentation. There are lots of words on it. We're going to share briefly the things that are kind of nice to talk about. We're going to go in depth on the slides that we want to really get into. If you're familiar with Zoom, which I think most people are, unfortunately, at this point, please write your questions in the chat. You've heard these prompts before, or you can write them on a notepad or whatever, and then you can plop them in when you feel. But at the end, we're gonna have questions for you, because some of these things that we're proposing, it's only gonna work if you guys are gonna agree to them. So we're gonna have to ask you all some questions, and then we're sure you'll have some questions for us. We may not have the answers right now, but we're gonna wanna keep those questions and then continue to have the conversation. Unless anyone has a big question, I think we can get started with Mitchell. Thank you, sharing his screen, and we're gonna get started. All right, as you know, we're kids making things happen. We're gonna make this summer happen, and it's gonna be healthy and safe, and this is our first stab at how we're gonna get it going. All right, so in our slide deck, which we will also download and share with you all as a PDF. Again, this Zoom will be recorded, so you'll be able to watch it when you're bored and doing nothing and want to just see all of our faces, but we'll have that for you, and we'll also have the slide deck for you as version 1, because again, of course, this is going to be continuously updated. But we're going to go over what we do at camp. We'll talk very briefly about the project we're doing this summer. We're going to talk about how we plan on creating and maintaining our bubble, the pre-camp quarantine, the bus protocol, our health screening and monitoring, NPIs. We're learning lots of new fun medical lingo, which are non-pharmaceutical interventions. The change for camp, which will be our cohort structures. testing and pre-testing, mental health, and we'll go briefly into program adaptations. So let's go to the next slide. Okay, so the big thing that we really just wanted to just share is like, how is camp gonna feel this summer? I know a lot of people so far are, from the people who I've spoken to, are excited just about the idea of being outside and playing in dirt. But we also just wanna explain how similar camp will be with some added obvious precautions. So let's get into that. So we're gonna do the things that we normally do. Like I said, we're gonna make incredible projects. There's still gonna be independent work. We're still making the big project. We're still gonna have domains. We are still gonna go swimming. We are still gonna do crazy, weird things at the campfire, and we're gonna meet interesting people, and we're gonna have talent shows. We are also doing things safely, and we're gonna have to do that by creating a bubble, practicing active hygiene, which is something that most of us already do, but we have already been in the practice of doing more of that. And we're gonna have to monitor our individual and collective health in all ways. Yes, next please, sir. All right, so for anyone that's new, you may have looked at our site, but our days are probably gonna be very similar. We're gonna wake up, we're gonna eat breakfast, we're gonna clean our cabins, we are going to have community work, we're gonna eat outside, which we try to do whenever we can anyway. We're gonna get dirty and mix weird straw and mud together for our cob material for the Universe project. We're gonna also go swimming, we're gonna have domains, and we're gonna do highs and lows before bed at night. Our days are gonna look very similar as far as what we're doing during the day and night. And again, if you haven't seen the project, it's really cool. Yi, who designed the project, again, I'm gonna continue to say this, he just graduated from Yale with his MFA, and he created this project. So we'll also share the link with you if you haven't seen more about it. It's called A Universe. All right.
Okay, hey everyone, Mitchell here. So I'm gonna talk over a chunk of the slides about creating our bubble at camp. There's a slew of phrases we're gonna throw at you. The bubble is one of them, and obviously these are actions to create the bubble both before camp and then obviously maintain it while we are at camp. So the big hitter for that is prior to camp is probably an anticipated quarantine. So our proposal is kind of a big ask. The current guidelines are still stating a 10-day quarantine for campers, and we felt it was safest to include families because you are sort of in that bubble prior to coming to camp. This is also a big question for us. We're wondering how that is possible, as it is sort of the best practice for anticipating creating that bubble. And this applies to staff members as well. So staff will be quarantining at camp for 10 days prior to the beginning. So our hope is that that would include all the things that a quarantine does already, and that you're home, you're not partaking in social gatherings or traveling, and then obviously self-screening. There will obviously be questions about the quarantine, so please put them in the chat. Moving on, prior to camp, also the moment that you do sort of transition into coming to camp prior to getting on the bus, we're going to have more of a checklist for your luggage. There's going to be a couple things you're going to need, which are obvious: masks, and maybe not so obvious, having a more contained bathroom kit. One big point, sorry, that I did not cover is that the bus procedure has changed. We will be doing all the departures from Beam Center in Red Hook. So it creates a little bit easier of a space and environment to take it slow, and families to come in and do all the check-in, which will include sort of a screening of symptoms. And then obviously this year, a pretty heavy duty health form and health waiver, just kind of going over all the bases for quarantine and symptoms. And you've probably encountered this before, but also having received a negative COVID test.
Also, Mitchell, I just want to say, in the past, we've allowed some forms to be faxed if something was there, but if all of your health forms are not complete, then unfortunately your camper will not be allowed to be on the bus.
There isn't explicit wording on out-of-state travel. I know there are some campers who maybe won't come from New York City. So we are sort of revising our guidelines on that, because that's a different procedure than the bus. And just to note, at the end of camp, we will also be busing everybody back. So there will be probably a similar sort of unloading procedure that we will cover more in detail later on. And then obviously the bus arrives at camp, and that sort of first few hours at camp is crucial. We have a litany of rotations that we do to orient new people, new campers, but also reorient everyone to how camp works. So that includes all of these little orientation sessions that everybody rotates through in different small groups, which we'll go over more in detail.
Okay, I'm Rebecca. So just yet again, we'll offer this disclaimer multiple times. The protocol is getting updated every few weeks. We are going to be keeping up with the guidelines and recommendations that the ACA, the American Camp Association, and just New Hampshire State is putting out. And as we do that, we will also be updating all of you. We can go to the next slide. So MPIs is one of the biggest new pieces of language that we've learned in our studying around how to have the safest experience at camp this summer. And an MPI is a non-pharmaceutical intervention. So anything that is not vaccination or medication, basically anything that is not pharmaceutical, is an MPI. And so on the next slide, we have a really comprehensive list of all of the MPIs we're going to be engaging with. Mitchell's already talked about all of the ones prior to camp, including pre-screening, health screenings, shelter in place, so quarantining yourself and getting tested prior to coming to camp. And we're about to go into a bit more detail about the ones that we'll be doing at camp. And so on the next slide, the most important thing that we want to emphasize, if we can go to the next slide, please. It's okay. Is that the biggest non-pharmaceutical interventions that we all have to be working together on is that we are going to be outside as much as possible. We are going to be wearing our masks all the time, with the exception of when you're swimming or when you are in your cabin, and we are going to be social distancing. These are crucial for any moments at camp when we are a large group gathering and we are all working on an activity together. The American Camp Association really love this Swiss cheese analogy, which is basically talking about how the layering of all of these NPIs is really what's going to help keep all of us covered and safe this summer. So Of course, masking is very important and does a lot to help prevent anyone getting sick or the spread. But when you mask up and you are outside, or you're masked up and you are outside and you're social distancing, it only helps raise our chances that we're all going to stay consistently healthy and safe this entire summer. Right, Mitchell, you're next.
Okay, and then another big sort of on the ground practice at camp is just general hygiene. Again, this is all stuff we've been actively getting better at over the last many months. But I think the important thing to keep in mind for camp is that hygiene is a little bit more, is an integrated part of camp for us, especially when you think about an area of camp we've had called community work, where everybody is sort of chipping in to, you know, keep up a portion of camp. That community work is now, could be engaged as an active time for sort of disinfecting or cleaning our communal use spaces. The hygiene is also sort of a training procedure for staff who will also be sort of like hygiene helpers. And then obviously an orientation at the beginning of camp just to review all those hygiene protocols. And then obviously constant cleaning and disinfecting that will naturally include an increased schedule for all of our disinfecting of common and work areas.
Mitchell, I just don't think you changed the slide on our deck here.
Oh, I'm sorry.
It's okay. Thank you.
Is...
You're good now.
Okay.
Thanks.
This is the information. Sorry, lastly, just to cover the last point on this slide, we are also going to incorporate sort of hygiene stations. So it's just accessibility to not only like water, but also PPE and hand sanitizer, all the things you've encountered if you're out in more public spaces. Huh. Okay, there it's loading. Sorry, there's a little hiccup in the slide switching. Health screening is another NPI, and we're going to be doing daily check-ins, and that happens best in the cabins, and counselors in a cabin being able to sort of check in with each other, and then obviously checking in with the nurse. Just we've had that system in place. That it's a well-oiled machine of keeping in check with general health, and this will include all of our COVID prevention techniques. Okay. And all this sort of elicits like who are the groups that are checking in with each other, or how do these groups operate with each other, and what kinds of groups are we working with? And so the pod and cohort model is gleaned from the American Camp Association, and also was employed by different camps who actually operated in the 2020 season. And so this is really a model that seems to work really well. It's already sort of in place at camp in that there are pods and cohorts. A pod is essentially a cabin, and it's a smaller unit of 10 campers and 2 counselors. And that group is able to kind of operate with each other. They're obviously in the same sleeping quarters, so they will also be sort of in the same unit that can eat with each other, because eating is another sort of vector of exposure at camp. Pods will also be used to define smaller groups of staff that aren't in the cabins. And then pods exist within a cohort. And a cohort is just another, it's the next size up of grouping. And that for us will consist of 3 pods, 3 cabins. and that's roughly 30 to 40 campers. And then our programming at camp is reoriented a little bit so that cohorts can all be doing separate things at the same time. So it's just really a matter of how do those groups organize, and how do they have different activities and spaces to utilize during regular programming. Yes, that makes sense. Okay. And then this is another big one. We will have a testing schedule at camp, and that schedule is once a week. So there's a way that all plays out, and there's some explanation about what kind of testing we're going to be doing. So there's obviously the test prior to camp, and that happens as few as 3 days and as many as 7 days prior to departure, and you'll have those before you get on the bus. And that will apply to campers who might arrive outside of the bus as well. And then we're going to initiate a test the first day that campers get to camp, and then again on day 7, and then again at the beginning of weeks 3 and 4. So it's just a way for us to have the most consistent way to check in with our levels, and that's happening weekly. And the way we're doing that is a technique called pool testing, and this is starting to become more prevalent and applies well at camps, in that I'll try to explain this as easily as possible, but a pool test is essentially everybody at camp is tested. So they're all taking all these individual samples, and there's 2 samples for each individual. And what happens is all those are tracked according to the pods. So one cabin, all of their samples will be tracked individually or stored individually, and then all pod samples, their second sample will also be put into a like container. So they run an initial test just on the combined samples. And if that combined sample produces a negative test, then everything's fine. We don't need to explore further. If that combined sample tests positive, then they have individual samples already that they can go back and kind of extrapolate where the vectors are. And so all that being said, the pool testing still lets us track individually, and then everything is organized according to the pods so that we can do our contact tracing at camp. So that might sound really heavy duty or kind of confusing, but it's all just giving us safeguards and of the ability to track how things are moving at camp. Okay. And Rebecca's going to go through these next few slides.
Yeah. So in the case of a worst case scenario, we do a pool test and somebody's test comes back positive, or a pool test comes back positive for a cabin. The cabin immediately goes into quarantine. That second swab is tested, so we find out who has gotten the positive test. And whether they're a camper or a staff member, if somebody has a positive test come back, they're immediately put into isolation and need to leave camp as soon as possible. The rest of the cabin who has been exposed to this person goes into quarantine for 10 days so that we can keep track of their symptoms and monitor them. It also gives us some time to do some contact tracing, which is what the pod cohort structure is also really has built into it, an ease of being able to contact trace. And then we test them again after the 10-day period, and if all of their tests come back negative, they return to camp programming, sorry, as normal. And should somebody else's test come back positive, they isolate as well and have to go back home. So the isolation goes into effect immediately. If somebody gets a positive test result, they have to get picked up from camp as soon as possible. And then on the next slide, we have been thinking about how to address the fact that if an entire cabin is in quarantine, how that might affect, oh, I'm sorry.
And I'm like, are you crying or do you have to sneeze?
So emotional. No. So we have been thinking about how going into quarantine will affect an entire cabin's experience of camp, because they can no longer participate with the rest of their cohort at that time, but we still want them to be able to do things. So while they are in quarantine or isolation, they cannot participate in the broader camp activities and they can't be present in public spaces. However, they can still participate in independent work. They can still work on the big project as a pod or as a cabin. And they will still be able to do pulse and flex. We'll still figure out ways in which they can still be active and they're not just being kept inside of the cabin. We're working on this protocol more and more as camp gets closer, and we're keeping track of like all of the guidelines that are being given to us. So we will offer updates as they come.
In the chat. Okay, so clearly, firstly, thanks for sitting through the big stuff there. It sounds hard to hear, but again, the information that we collected, where we got all this information from, Mitchell said, were from camps that ran successfully last summer. There were many that did so. So it sounds kind of harsh, but we're doing it because we want to be able to run camp. So appreciate everyone kind of sitting through and also adding your questions to the chat. If I have not replied to your question, we're going to get to it later on. If you have already completed or started your camper application, we wanted to make sure that there was space in there for everyone to communicate how this time has kind of impacted their family. You know, we work with a wide range of people from all over New York City and all over the country. So we know that that it impacts different families in different ways. So mental health is kind of a bucket concept that we talked about beforehand, but we know now there's a new kind of shared trauma that we're all experiencing together. So we want to definitely make sure that there's space for us to talk about this. So again, for people who are returning, our communication is essential. For returning campers who only have to just fill out their returning camper registration, we will be having conversations with you before camp just to talk to everyone, talk to families, see how things have been going, see if there are some updates. The thing that happens the most at camp that makes me scratch my head is when I find out in the middle of camp that a camper experienced like something extremely traumatic, like a pet dying or a divorce or something that is kind of huge, and parents say, oh, we didn't want to bother you with that information. It is not a bother. It is going to be helpful to us and to everyone who is going to be part of the team of making sure that your camper is okay and having the best time. So the communication aspect is huge. So we're going to try to create more and more ways for you all to feel comfortable sharing some of this stuff with us so that we can, you know, it's real life. We want to be able to support your family and your camper the best way that we can. So I've already been really grateful for anyone who's already applied. We're hearing really great insight from your campers about how this pandemic has impacted them. And of course, new campers, we're chatting with you already, but we're going to want to check in with everyone probably again before closer to when camp starts, because we don't know what's happening in the next couple of months. Also staff training. So we already have a 7-day staff training that was pretty robust. Now, because of the quarantine, we'll have a 10-day staff training that will be even more robust. We're going to use that time to our advantage. There's some ACA training courses, and ACA again is the American Camp Association. So they have some training that we're probably going to try to get camp counselors to do before we get to camp. And they're already also offering some other ways to bolster staff training. And we also have had a lot of experience through Beam Center last summer, just working with different people through our virtual programs, just about being in the space and dealing with some of the impacts of the pandemic. Next slide, please, Mitchell. Okay, so the other part about this is camp is really small. So any campers who have been here before can attest to that. After a couple of days, we really get to know each other. So I'm also grateful. A lot of times I'll have a camper come up to me and say, hey, I don't know if my friend is doing okay. I think you should chat with them. So people really get to know each other, and we kind of work together to make sure that people are in their best space to do what they want to do at camp. Another space that is sometimes helpful for different people is the time that we give to cabins before bed. And each cabin kind of calls it their own thing, but it's generally known as highs and lows, or you may know it as roses and thorns. But sometimes a lot of different information comes out during that time. So counselors in the morning communicate with the rest of the leadership team and other non-bunk staff to share any important things that they should know. Not everything. Some of that space is a sacred space for the campers and the cabin. But things that everyone needs to know, it gets kind of shared with the group of the care team. And also our schedule is pretty, we try to keep it moving, where there's some, we're working on the project, then we'll have a break, then you might have a domain, and then you do something else. So we really try to keep people moving so they're not just stuck doing the same things like many of us have been for the last while, sitting on our chairs looking at a computer. So we also know how important that is mentally, being able to kind of have a different schedule where you're doing different things during the day. Also where you're doing things where you feel accomplished, where you were able to do something and you're like, I've finished this project, now I can move on to something else. So we try to, we're also keeping that in mind as we adjust the program to the new cohort structure. All right, Mitchell, thank you. Okay, so we also know that camp really works because we have lots of different people delivering things to us for independent work. When we start doing independent work, we're gonna get deliveries daily. Later on, I can send you the picture of the UPS man that that retired, and I was so sad because he was our UPS guy for years. But we get really good relationships with our delivery people. So I have full confidence that they are going to be able to adhere to whatever guidelines that we impose on them, also the state of New Hampshire. And they're also probably delivering to Camp Foss, who we share our lake with. So all of these things are not going to be new to them. But obviously, anyone who's coming to camp will have to quarantine for a certain amount of time. But of course, this is going to be different for our UPS deliveries and our food service deliveries, but there will be all masks all the time. And they will stick to the places where they need to be in order to give us our goods.
Okay, I'm just gonna pause on this slide for a second to note that there is an extended version that goes on kind of detailing all the programs and adaptations and how camp feels, via the facilities or the dining protocol. And we're not, I think it's important to maybe pause at this point and be able to ask some pertinent questions that you have. This will be in the current version of the slideshow. And I'm going to include that in the chat for you to download and view. And so if you have, obviously, please look at that and explore that in more detail. And please follow up with questions detailed questions pertaining to programs or adaptations. So I'll include that in the chat here in just a second. But I think at this point, we've got about 20 more minutes here. So I'm going to stop the screen share and we can get into some of these questions.
Awesome. Okay, so we have only 5 questions so far, and I was really happy to after my first couple of conversations with families, most of the questions were not really about how we were going to do camp safely. They were mostly about our program, but I'm glad that we have some questions here. Anthony, I can say yes, there are going to be sports for sure. Yes to sports. But first, so we'll go over our first question, and I think Rebecca will be able to take this. Why will we continue to social distance at camp if the whole group is already a bubble?
Yeah, so we already know that even if you are not showing symptoms, you could still have the virus, and that it takes 2 weeks for symptoms to start showing themselves or for you to get a positive test result. And so that already gets us halfway through camp. And then it's really, this is a conversation that is going to be ongoing, where we are truly following the sort of tone that's being set forth by the ACA and by the state of New Hampshire that is choosing to be more cautious. Despite the Swiss cheese model and having a really beautiful bubble, there's still always a chance that somebody could get sick. And by being ultra stringent about the protocol and maintaining them throughout the summer, it's the best way that we can ensure that everybody will stay safe this summer. And there's also the fact that we're not, these protocols of keeping a mask on, of being socially distanced, is not going to make it so that we are not interacting with each other anymore, or that that camp is going to be dramatically different. There's still so much of the experience that is going to be familiar and that is going to be maintained. It's really our highest priority that camp is the experience that everybody knows and loves, and also that we are keeping everybody as safe as possible. Also, there was another question before that about the timing of a negative COVID test. You would need to get that test within 3 to 5 days prior to when the bus leaves. If you're able to get a PCR test, the day before the bus leaves, that's cool. You could also do both of those just to stay extra safe, as well as a question about dropping off at camp. Yeah, we would need negative test results for everybody who is coming onto the campgrounds.
Okay, so also, I think Rebecca covered it, but if not, why we wouldn't be able to reduce our social distancing after 2 weeks. Alyssa, let me know, or anyone else. Okay, great. And then also, I think we covered it, but maybe we could just go over the details again. The protocol if someone is sick or gets a positive test at camp.
Yeah, I mean, The first thing is, if you get a positive test result, the hypothetical you go into immediate isolation. The first thing that has to happen is that we need to make sure that no more contact is being made with the person who got a positive test result and everybody else at camp. That does not mean that they're going to be ushered off and completely disengaged with. It just means that we are now isolating them. There was a really good question in here about, we said if somebody gets a positive test result, that person has to leave camp, either get picked up or leave on their own as soon as possible. Public transportation is not an option. And a very good question was asked in here that if they flew in from elsewhere to come to camp, how do they leave because they can't fly with a positive COVID test result? This is a really good question. This is detail that we have not gone into yet, but as we do develop this protocol, we can answer all of you. Does that satisfy that question, or would you like to elaborate on it a bit more?
Well, that was my question, and it's just because we live on the other side of the country. So, for instance, if my son was a kid that became sick with COVID, I don't know how I would get him anywhere but a hospital, or if he doesn't need a hospital, I don't know what off campsite looks like. He, at that point, the logistics of that would just be such that we would be on one side of the country, he'd be on another side of the country. And so that just needs to be thought through, because it could be any one of your campers from anywhere. So yeah, I don't really have I don't really know the solution to that. I guess, does that person go to like a rented cabin and then do the parents fly in and take care of them? Or, there's a lot of questions.
100%. It's definitely a huge thing. I mean, we've had campers from Australia, from China. So this would not be our first time dealing with families who were away. We've also had campers who are local, but their parents were traveling during the summer months. So obviously we wouldn't put the camper in any situation that would not be clearly communicated with together, with the parents and the family, with, of course, keeping the camper, the other campers safe as well. So that's definitely something that we have to think about. But we've had situations where, like I said, international camper break their leg. Parents are traveling abroad and the camper, something happens. So the coronavirus aspect of it is definitely different, but the international and out of state, and we've had parents who've been off the grid in Tulum, so we've been able to safely support that type of concern before. So I know whatever we come up with will be safe and protect both of us. Also, just the quarantine concept, we have done that before too. Some of my favorite things that I've done in the past is making lunch for our quarantine campers. We get a call from the nurse and she goes, "I need 4 lunches to the health lodge." And so we already have some protocols around quarantine campers. So we definitely, it's not fun. We're not going to sugarcoat, like they're going to have a great time back there. But they're not, there's a window. There are things we do whatever we can to support their time in there, to make sure that it's not completely horrible. So that would be something that wouldn't be new. It would just be amended. But thank you. This is all good. Oh yeah, lice checks still happening. The lice people are probably, we probably will communicate with them. I'm sure they have some procedures that we'll probably want to adapt as well. Okay, so someone asked also, with the pod and cohort structure, will campers have less freedom to roam around camp? Rebecca? I saw your hand moving.
I can jump in too.
Okay.
Just knowing how, the the day at camp is pretty well structured. Historically, there's lots to do every day, and everybody sort of has a place or a scheduled thing that is happening. And we in the past, we've always had a really good track on sort of where campers are, and that all, I think, plays into this year as well, in that there will typically be either options or scheduled parts of the day where, you know, campers are in specific areas, and we have to keep a track on that, especially this year, because we're aware of groupings and numbers in each group. So a lot of the scheduling will be based around cohorts, but in a given cohort, maybe a pod is able to take a hike together, or in a domain, they get to choose where they want to build something on camp. So sort of layered into the scheduled things are times for choices. Anybody want to add to that? Essentially, I mean, camp will still be fully accessible, but I would say there may be a moment where a camper wants to go do something entirely different, and we would have to say, you have to stick within your cohort for this time period. And there will be time to do swimming later, or you will have time to play circle rules football within your cohort next period. So that there will be moments where we have to, I think, establish the needed distancing between cohorts. I hope I answered that question. If there's follow-up, please ask.
Yeah. Yeah, no, Samantha, great questions. I don't think we have the direct answers for those yet. I can't see why a cabin wouldn't do their cabin camp out, because they're already a pod. So I don't see why that wouldn't happen, but we're still sorting out as far as after dinner activities and meals, which were most of the times where everyone was together, what those times are going to look like. So those programmatic things have not come across our desk yet. But we know, you know, as far as scheduling, we know we're going to have to do something. So we're grateful. We know we're probably going to look to and I'm saying an idea that I don't even know if we've talked about yet, but probably looking to get more larger tents, because obviously the white tent where all of our after dinner activities happened is a great, huge space, but I don't think that we're not going to be everyone in the white tent all together. Also, as far as just some kind of like minor things like benches, we're like, oh, we're going to just have to order 200 foldable chairs, you know? So like, you know, just simple things like that. Cedar knows when we're like, all right, everybody to pick up a bench. It's going to be pick up a chair, pick up your chair. I made a joke that one of our projects should be everyone have a little chair backpack. So you can have your chair with you wherever you need to go. Emily, it looks like you have a question.
It's not a question, it's just an observation and just something to mention. I've heard feedback. Our school is in hybrid mode right now, and a lot of kids went back for the first time this last week, and I've heard from a lot of moms that after wearing your mask all day that the kids are just exhausted. I mean, it seems like kids who usually go to bed at 10, 11 o'clock are falling asleep at 5 and 6 o'clock. And I don't know, but I believe that it's being attributed to sort of reduction in oxygen from wearing the mask all day long. So I just thought I'd mention that because maybe the full session of camp that you guys usually do is going to be exhausting with a mask on all the time. So just thought I'd share that.
That's a great point. I think one of the things that we've talked about in the past, because camp is spread out and it's like a very large physical space, and we have it's been heavily scheduled, and I think a general rule as we go through with the full leadership team and sort of detail the scope of all the programming is sort of like being able to back off the gas pedal on all the density and intensity of the programming and just give everybody a little bit more space and time to get around. And I think that plays partly into not just mask, but giving more time for sort of our dining routine and giving more time for transitions and giving more time for hygiene and showering routines and things that let people not rush into a situation without our protocol in place. So I think that's a really good note to carry into sort of how we, then go ahead and define all the details of the programs.
Well, also maybe since it's such a big place, if there are activities that are outside and people can be spaced far enough away, maybe they don't have to have masks on during certain activities at certain distances.
Yeah, I think that will definitely be the case for very specific activities.
Go for it.
Yeah, go ahead.
Hey, I don't know where the raise hand function went. I should know by now. I was just going to say, so much of the freedom of camp is so much part of like my son's experience there the last few times, and I think like the community of the group camp as a whole. And I think I just hope that the spirit of that can be carried through, because I think for him going there is this place of like pure freedom, and if that gets lost, it will lose his sense of joy he gets from the camp. So I know you guys know that and can't magically, snap and make everything the same, but that is something I'm thinking through right now.
So
Yeah.
I'm thinking, go ahead, Rebecca.
Well, yeah, I mean, I think a thing that I would like to maybe reemphasize is this pod cohort model that we've been working out is really, it's been tested by other camps, and so far as we've been thinking through what the camp experience can be like this summer and how we can make it as like familiar as possible, that's going to be what we're leaning on a lot. Because when you are in a cohort, that is like the expanded bubble for your social group. And so there are different ways in which maybe a cohort can hang out, but yes, there is a challenge posed to us if we want to have all 100 campers together in one place. And so a lot of these experiences that were full camp experiences, we're still going to make happen. It's just possible that some of them will not be all 100 campers now. It will be the 30 to 40 campers and their counselors together rather than everybody in camp. And this is just, it's a lot more people than a lot of us have been able to spend time with in the past year, almost certainly. So it's already a significant improvement, but yes, of course, it's going to be different than camp.
I'm just thinking of,
yeah.
I'm thinking of like an example of when I've seen specifically Oliver roaming around camp. And I think I can share how that will still be similar. So in the cohort model, we used to organize camp in two parts. So like for domains, we had two sections of domains. So some people had their domain in the morning, some people had their domain in the afternoon. Now we're gonna have to do all of those things in three sections. So let's say Oliver is working on his independent work and he's working in the shop and he needs to get something from the art barn, and I'm walking down, I'm gonna see Oliver by himself walking from the shop to the art barn. Or during free time, let's say the other two cohorts will probably not have free time during that time. So we're gonna have our free time areas staffed as we would have during regular camp. And Oliver might choose to start his free time sitting in the project field, and then halfway through decide he wants to go and do something else. And he'll still be able to go and do something else during that time. So I just think it's going to, it'll feel different because the mass of people doing the same thing will be slightly smaller, but not considerably smaller, because it's going from halves to thirds. So the areas that will probably say cohorts are only allowed to, cohort jigsaw can only be, because you know we're going to have some weird names for the cohorts. Cohort jigsaw can be at the waterfront or in their cabin area or at the art barn or whatever, and it'll be kind of exactly the same. It's just that the amount of people who he might stumble across during that time would be less. So that's just my kind of understanding of what that kind of freedom would look like. Because you know, if he's in a fundamental, he's in his fundamentals. You know, so the freedom time would be pretty similar to how it would exist in the past. And this is just a big question that I want to get to because we're getting close to 6:30. So I know some people need to start making dinner. But our biggest question that we wanted to pose to the community was about the quarantine, family quarantine before we get to camp. Did we talk about that? Did I completely forget? Because that's a huge one. If families think that it's going to be tough, it's really going to be based off of trust. And if I don't think that's something that we can reconsider, but if that's something that people are like, I don't think we can do that, we have to know.
How do you define quarantine? Like, could my kids still the week before be playing out in the park with friends they know because they all wear masks at the same time? Would that fall into not quarantining? I mean, we have never have anyone come over, but.
I think as camp gets closer, we'll send very specific guidelines as to what quarantine means. This is still something that we're figuring out. Personally, I lean on towards caution, which is that I don't really know about that. But we're going to do more research and have like very specific guidelines so that it's not left up for interpretation for all of you. Right, because like we still have to go to the grocery store. There are things that still need to happen.
I guess, yeah, that it might be helpful to hear from a couple of you how you would define that quarantine, and what that's useful for. It's useful for us to hear like how you might define that, because ultimately I think it does come down to some guidelines, but also interpretation of what that is.
Well, I just had a question about it, but it has to do with how you define it. You know, you're talking about a family with siblings or things like that. So, you know, for instance, at the school that my kids go to, that included when they did a quarantine before they all came back on campus, it included, well, you couldn't be part of any like group sports classes or activities, and that included for your siblings as well. So it's like, oh, the kid is coming to camp, but can their brother go do a baseball camp outside, or can their brother do an outdoor tennis camp, or, you know, so like for a 2-week period, okay, I assume it's for a 2-week period, but maybe it sounds like it's only for a 10-day period. What does that quarantine look like as a definition for your camp? Also, there are parents who have to travel for work. So then does that break a quarantine? How does that play into the whole thing? And I guess the other question I had, or just the thing to bring up, is it sounds like you can get a PCR test as much as 7 days before coming to camp, whereas a lot of other programs that I've seen that require testing before you come back to campus are like, or fly, for instance, are usually 2 to 3 days max.
Yeah, I can answer this. So it's 3 to 5 days. This is also, again, on the assumption that campers and their families are quarantining. Of course, if you can do it sooner, that's incredible. But we want to keep in mind, at least in New York City, that there's ebbs and flows of the ease with which you can get a test. And we do not want somebody to not be able to get on the bus because they thought they could get online to get a test the day prior and it didn't work out. This is also, again, this is based off of the guidelines that have been shared with us by the American Camp Association and based off of things that worked last summer. But you do bring up a really good point about the different ways in which quarantine has been defined by different schools, by different institutions. How does that affect like how you go about your day and like if you need to work. And these are all really good questions. I don't want to guess and give you all definitive answers now. That might change. Everything is going to keep getting updated. Things are going to keep changing, and we'll keep you up to date as we go, but we don't want to leave you guessing. So we are going to have a very clear guide prior to those 10 days of quarantine before camp. There was another question here asking about vaccinations. This is a really good question because we're already, myself, Cassie, Mitchell, we've already started getting vaccinated. It's becoming more available. And we thought this was incredible and it was going to make everything prior to camp a little bit easier. And then last Thursday, we got updated guidelines from the ACA. And prior to Thursday, it said you do not have to quarantine for 10 days before coming to camp if you're vaccinated. On Thursday, we got an updated guideline that said it doesn't matter if you're vaccinated, you still need to quarantine. And so the ACA is being extra cautious. We are going to follow their lead in also being extra cautious. Also, the vaccine is available for adults right now. It's being developed for people as young as 16. There's no vaccine available for people younger than that, to our knowledge at this point. And so, again, we want to make sure that we are making camp as safe as possible for everybody who will be there. Vaccination is just not available to everybody who would be present at camp at this point. But these are all really good questions. And again, now that you are asking them, we are going to ensure that we are staying up to date and updating you on them.
Perry?
Let me do that. I have to unmute.
Yeah, we're
Are we
unmuted.
muted? Okay, no, just happy to support the quarantine, just from our understanding, tracking all of this stuff in the city and all of the ways that NYC DOE is trying to deal with this. The quarantine is the most effective way to make sure that that first 10 days goes without incident. So just hugely in support of whatever we can do to make that work.
Yeah, I think you guys are extraordinary. You are so on it. It's so amazing. And I think you're right to judge that. I think going into it, the quarantine is probably
the best thing you can do.
Entering the bubble. You really want to make sure.
It's a hard thing.
Yeah.
It's a hard thing for the parents to commit to, but it's so important.
Yeah, you might even have parents check in with you every 2 days or something once you figure out your guidelines. And that sort of forces parents to be self-aware as how important it is that they're entering kind of a community relationship during those 10 days, even though you may not see other campers or other people, your commitment to the community begins during those 10 days. You don't
have those isolation moments.
But you guys have it down. You really, really have it down. Thank you.
Thank you for that. That's a really good idea. Because yeah, we created some virtual programs that would be a really great way to start the community and give people something to do while we were all quarantining. So that's also a really good idea that we have not yet thought of. Thank you. Again, I don't want to hold anyone here. It's past 6:30, so if you need to leave, please do. But I think thank you for those who have stayed on. Again, this is still being recorded, so no worries. But Stephanie, please.
I serving this year as an interim head of school at a private school here in Louisville, and so we've thought through, from a school side, a lot of the things that you guys are thinking through from a camp side. And we're pretty strict with our quarantine policies for travel for families. And but something that we do offer families is if they have for example, a member of their family who has to travel for work, if they can create provisions where that person can quarantine separate, in the same house, just like they will isolate separately who are COVID positive, they can quarantine separately, and they sort of explain their provisions for that. We've been able, because we offer that, we've been able to get a lot more community acceptance of the quarantine rule in general. So, again, it's all based on trust to begin with. So if you can create some problem-solving options with families, it might make it more available for people.
Thank you. comments, questions? Bye, Anthony. I am so grateful for everyone's questions and comments. Any last thoughts from anyone? All right, silence is golden in these group questions. Again, evolving conversation, but the only way we wanted to do it was with you all in the spirit of BEAM. It's a collaboration. So we'll start it, but the rest is going to be together. Thank you everyone, especially our new families who are coming in, especially from out of state. So thank you, Emily, for all your comments. But like BEAM, this felt great. We weren't scared because we know our people, and we knew that you guys would be coming because you want to hear what we're saying and work with us to make it as good as possible. So thank you all. Rebecca.
Yeah, thank you so much.
Mitchell.
Your insight is incredibly helpful. We needed this.
Thank you. Bye.
Thank you.
Bye.
See you.
Bye. Thanks, everyone.